Hello and welcome. This is Dr. Jerry Como. I'm here in my Boca Raton office, and today it's all about cementing crowns. So as you're looking at the case right now, you're going to see the crowns as they come back from the lab. I do in my office, I have a designated area for looking at cases to fit check them. And during my fit checking process, I'm checking a number of things, not only the bite and how the models come together, but also the contacts in between the teeth. And by my own protocol, and I'll go through that, I'm going to utilize various materials. Number one, this is a very ultra thin artifoil where it's thin enough so that you can place it in between the stone part or the model part and the crown, and it will mark only on one side. As you pull it through, you'll see a little line that delineates the contact itself. Now, if it were to tear at that point, then we know the contact would be too tight for the patient. We'll flip it around, put it on the other side, slide it into place. And we not only do it on the model, we do it in the mouth as well. Slide that. You see the line it creates. No tearing. So that is part of our protocol. And of course, checking the bite as well. So we did it for this side as well. Now we're going to go in the mouth and look at the soft tissue. By the way, with the microscope, we're able to make sure that the cases are seated properly. And I continue to go over this with the lab, that when you're creating models, you want to be able to remove some of the soft tissue so that you can actually see the margin or the finish line of the prep. Once you do that, you can then seat the case, look down through the contact areas, underneath the contact areas, and the margins themselves. So you don't want to see any discrepancy there at all. So that builds confidence going in. When your patient arrives, you've got to simulate now the mouth. You've got to be able to see all this in the mouth. So let's go in the mouth. So with a microscope now, I'm going to be parking right now and open with 3.25 power. I'm going to blow air on the tooth, and the first thing we want to do is place a Siltrax cord, and that we like to have ready to go. In fact, I'll show you our box of Siltrax, and this is room 1, so we designate the box, and being room 1, this is the box itself. We have molar Siltrax, we have class 5s, we have 2-ply, pink cotton, and bicuspid Siltrax. All right, so this is our little box that we put together, and it's got a little snap on it, and you can go in and get what you need before the patient gets here. That being said, the first one we do is, and this is Siltrax 7, we take the Siltrax and then we want to spray it with a little water. So we do that, and then we want to, and that helps give it the tuckability that we're looking for, and then always remove the excess water. Once you do that, now you're ready to go in the mouth. Now you can actually use one or two methods, just a nice tucking method in there with the perio probe, or you can actually use something a little more broader, which is the gold instrument or a Hollenbeck. So now I'm just going to start by showing you my method. And as I'm tucking it in place, I'm also pushing backwards. So as I'm doing that, it's actually creating a little more thicker diameter to the braided cord. All right. So I'm going to do this with this tooth, and I'm going to come back and show you the final packing. I'm going to have some pink cotton in there as well. All right, so stay tuned. We're going to come through with another video here, but I'm going to be a couple of steps ahead of you. All right, thank you, and thanks for watching. I'll pick it up on the next video.